The Albert Lea Healthcare Coalition hosted a public meeting discussing next steps for the city's healthcare system after MercyOne recently announced the closure of its Albert Lea clinic. KIMT News 3's Brandon Cote was there for it to hear the coalition's plan to replace the city's loss.
Over 100 Albert Lea community members gathered at a public meeting today discussing the exit of MercyOne with one question in mind: what is the future of healthcare in Albert Lea? Last week, MercyOne announced the closure of its Albert Lea location due to the COVID-19 pandemic and workforce shortages.
It was a jolt. It was a setback.
The Albert Lea Healthcare Coalition says they are beginning their search for a replacement.
It's about our citizens. That's what it's about, in finding the right people that can provide great care at an affordable price.
The coalition invited community members to address their concerns about the void that now exists. What was your initial reaction to hearing MercyOne leaving?
I was extraordinarily upset.
Several attendees spoke up about not wanting to retreat back to Mayo Clinic health systems for care after the hospital moved several of its services to Austin a few years ago.
Mayo putting profits over patients, I think, has given a lot of people a poor taste in their mouth.
Others brought up concerns about the closure hurting the city's economy.
It's hard to bring in businesses when you don't have a full-service hospital here. And then now losing MercyOne, that's just another hit.
Ahrens is confident the coalition will soon find another healthcare provider before MercyOne leaves in late December.
The future of healthcare here is bright. We've had a setback, but this community will persevere.
In the meantime, the coalition is advising people to go to Northwood, Mason City, and other healthcare practitioners in Albert Lea until they can find a definite replacement. In Albert Lea, Brandon Cote, KIMT News 3.
And the coalition says they already met with one potential candidate today and are meeting with others soon. Due to a non-disclosure agreement, they're not able to provide any names.